Thanks everyone for being here. Tiffany and I are really excited to talk to you about this very important topic. So let's begin. I'm just going to give a quick rundown of the plan for our presentation. I'm going to talk about the background for our research and the process we used. Tiffany will then go into some of the main findings we came up with. I'll dive into some of the specific best practices we saw, and then Tiffany will take us home with the major challenges and some of the open questions facing us in the field. So let's begin. And to start, what I'd like to do is really set the tone and acknowledge that 2020 has been a very challenging year in more ways than one. You know, we are going through a global pandemic. We've witnessed some horrible acts of racial injustice and then seen resulting social unrest. And we've also gone through a very long and drawn out election as symbolized by this electoral college map, which you may remember looking at for nearly a week back in November. And, you know, we can think that intuitively, this has taken a toll on the mental health of the collective, and this is indeed what the data show. So let's just take a quick look at what we've seen here. In terms of health outcomes, more people are stressed compared to before COVID. We have 3 times as many people experiencing anxiety or depression. Moreover, the events have taken a toll on certain aspects of daily life, with sleeping and eating. We've also seen an increase in stress-related substance use. And furthermore, these events have highlighted some long-known, but now more important influences on mental health. So we've seen isolation taking a larger role in influencing mental health. And we've also seen financial stress owing to the impact of the economics of the pandemic also taking a toll and being an increasing source of stress. And we've also known for a while that mental health and work are connected. This is not something new to most companies. We've known that well-being and job performance are related. We've known that work-family conflict can be a problem for employees and their families, right? These are just a few examples of things in ways in which these two phenomenon are related. But what we've seen in 2020 is that these connections have all been intensified and magnified in new ways, right? So for example, work-family conflict takes on a whole new life when you're perpetually working from home, for example, or stress and burnout may be accelerated when there are these large global events happening in the background. So we saw this as a really important issue to focus on, both to get through this crisis that we're still in. And we also saw this as an opportunity for companies to essentially take inventory and ask themselves, what is their approach to mental health in the workplace? What strategy do they take? How does it fit in with their business strategy, their industry, and the makeup of their organization? So with this focus in mind, we had 2 main aims. So we want to look at this at the level of programs and initiatives, right? What are the benefits, things that companies can roll out to promote mental health now and moving forward? And we also looked at it in terms of the practice of management and leadership. We often hear that manager plays a large role in the employee experience, and well-being is certainly part of that. But how does this work together now? There isn't really a clear understanding. There isn't a clear playbook on how managers should promote mental health. So we want to look at this specifically, and furthermore, how companies can prepare leaders for this sort of role. For our methods, we interviewed many HR leaders from over 22 CAHRS partners. Many thanks to those who participated. I hope some of you were able to make it today. Many thanks for your participation. We synthesized our findings into an affinity diagram looking for the major themes, both implicit and explicit, across the different programs and practices. And then we're going to lift them up in terms of what we saw our overarching strategies that companies can take, as well as best practices that correlate with those. So with that, I'm going to hand the remote off to Tiffany, who's going to take us forward from here.
All right, great. Thank you, Nate. So we wanted to first start off by kind of going through some of our overarching findings from that initial poll of interview data that we synthesized. And one of the first things that we noticed is that through our conversations with partners, that many companies are attempting to address mental health through these very large kind of wide scale programs. However, many partners also acknowledge that this kind of one size fits all method does miss some of the unique needs of employee populations. While there's no doubt that there's a spectrum of mental health challenges that exist within each of these groups, and there's also the overlap that exists between these groups, these six did emerge in our interviews as those with the most notable needs that required more nuanced approaches. And these are not so different than some of the populations that were highlighted in our peers' presentation as well. For manufacturing, as an example, their needs are tied to their job function. Many folks in these roles continue to physically report to work throughout the pandemic. They also have more limited access to computers over the course of the workday. So this does limit their ability to take advantage of benefits like a flex work program or virtual resources. But I would say by far the employee group that was highlighted in every interview was the caregiver population. Whether it was an expansion of emergency childcare services, additional flex work arrangements, or an inclusion of elderly care services. This group has definitely faced an extreme increase in stress as they juggle the responsibilities associated with care, and companies needed to find a way to respond and support these employees specifically. And this will actually be a topic that we'll continue to kind of explore throughout the presentation, kind of this nuanced approach to these employee populations. But as we started to go through our interview data and try to make sense of the variety of strategies that we were happening across different organizations, we started to think about how we could potentially map this onto a formal framework. Our first inclination was to think about mental health strategies as a continuum, where on one end we find companies that are in this kind of phase one approach. It's still a relatively new topic. And then on the other end, we find companies and programs that were more well established and more mature. As we started to unpack this dimension, we asked ourselves questions like, is the strategy proactive or does it feel a bit more reactive? Does it sit within the larger compensation and benefits team, or is there a specific health and wellness team? And if that team does exist, who's leading that work and how long have they been in that role? I think another big question that we started to ask and started to emerge was also, is this initiative actually organization-wide, or is it solely in the United States? And while this dimension was definitely helpful, we did start to realize that this model was actually too simplistic. And when we really started to unpack the richness of that data that we received, we realized that there was actually a second dimension that emerged. And this one didn't necessarily have to do with longevity. It more so had to do with integration and the scope of the programs themselves. So this is where we started to ask more questions like, who's actually creating and driving this programming? Is it just that benefits team, or are they also working with diversity inclusion? Are they working with learning and development teams? Are non-HR leaders involved in kind of the framework of the strategy? How are employees held accountable for committing to this work? Are elements incorporated into promotion models or into your performance review? Are leaders themselves modeling this behavior openly? And are non-HR employees given the opportunity to serve as ambassadors or go through these formal trainings as well? And this is kind of how we ultimately came up with this 4-quadrant framework that you see here today, because neither of these dimensions is actually more important than the other, and they're not independent either. There's a lot of interaction that's happening here. I also think it's important to note that there is no right quadrant for companies, because as we outlined in our previous slide, depending on your employee population or even the culture of your organization, what will be the most effective for you will likely not be identical to what it is for another organization. So this model is not meant to be any kind of judgment call. What we do hope, however, is that it helps you to think about where your organization currently sits, and then to think about where your organization wants to be, and to use these questions to explore some of the changes that may need to happen to your current strategy in order to go in the direction you hope to be in.
Thanks, Tiffany. I'm going to dive into some of the best practices that we saw, and I'm going to talk about this in a 2x2 way. We'll look at foundational practices, the essential responses at this time here and now, and also some more innovative practices we saw for companies that had kind of established this foundation and could then go on and try some more cutting edge things. So foundational practices, and then we're going to look at it again in terms of programs and initiatives, as well as practices of management and leadership. And here today, I'm just going to give a really quick rundown of these. We'll go into much more detail in our forthcoming report. So I'm just going to lift up a couple examples for each of these things. So firstly, one thing we saw nearly every company do was expand their EAP offerings for employees. This might mean, doubling the number of mental health counseling sessions available to employees from 5 to 10 or 10 to 20. It also meant implementing some sort of telehealth platform. Some companies had therapists on site that were no longer able to practice if the office closed down. And they would implement a telehealth platform to make it still accessible to employees, or they might work with an outside provider who had telehealth capabilities to make sure employees could access that. Furthermore, we often saw different webinars on these topics of resilience and mindfulness, and flexible schedules, not unlike those mentioned by Ralph and Haesong, for employees, as well as stuff like mental health days, vacation days for employees. Moving to management and leadership, one thing we saw a lot of companies do was do a spotlight on mental health as an important area. For example, in October, on a World Mental Health Day, we saw a lot of companies lift this up as a priority to message to their managers, to then get to their employees and really make this something that was a major concern for the work of the time. Again, just mentioning these, we saw the implementation of a COVID task force of some kind where well-being was a focus, often with HR at the helm there, and often getting other leaders from different departments involved to really make this a cross-sectional effort. And then we saw newsletters, intranets, and whatnot, often aimed at managers to get them to promote the resources for their employees. Moving on now to what we saw as very innovative practices. So again, having done those things, laid the groundwork, we saw a lot of companies move on to do some really cool things. So for example, we saw companies implementing mental health first aid programs. So you can think of this as a form of first response, kind of a first line, high touch response where someone really just listens and empathizes with somebody who's having a mental health challenge, not doing a diagnosis, not doing therapy per se, but listening, empathizing, and then redirecting to the resources available to that employee. We saw this as a way to normalize mental health and also bring it closer to someone who might be having a challenge, really meeting them where they're at. Someone might not be so willing to talk to someone in HR they don't know or reach out to a therapist without first talking to a fellow colleague. Some other efforts we saw: partnership with employee research group, like for the groups that Tiffany mentioned. We saw HR teams actually having a devoted unit focused on well-being, and really innovative ideas like converting facilities to childcare centers and doing company-wide shutdowns as a way to get people to take time off for their mental health. Furthermore, we saw when companies doing a spotlight on leaders with mental health challenges, actually focusing on a senior leader who had had a challenge and saying, hey, this was my experience with addiction or depression. This is normal. We have resources. This is something you can get help with, and we can help you. Really a way of normalizing and leading by example and practicing what you preach. And a few others that we'll go over in more detail in our report, undoubtedly, just lifting them up here. And with that, I'm going to close out the practices and turn it back to Tiffany, who will walk us through the challenges that we saw.
Great. Thank you, Nate. So we've gotten a lot of information, and it was a really interesting study for us because I think when it came to our first research question of, what are some of these practices, that's really where the wealth of knowledge came. But I do think on the other end, there were also a lot of challenges that were highlighted and a lot of questions that kind of remain unanswered. So on this slide, what we've done is kind of highlight these 5 different challenges and depicted them as pillars supporting a structure that you can think of as your own mental health strategy. These were areas that were most cited throughout our interviews, and all 5 truly need to be addressed in order to have programs that are not only impactful, but I think more importantly, also sustainable. I think something that I really appreciated from Haesung and Ralph's presentation is this idea of, we don't want to see atrophy happening. There are a lot of great learnings. So these questions in some ways can help us to think more long-term about how to make sure that these types of practices persist. And I think in many ways, these are applicable even outside of just your mental health strategy. So this first question here around ownership and management, this is where we really start to ask questions about how can work continue to be innovated by these HR teams, but potentially operated by other areas of the business to have a more well-rounded integration. It makes absolute sense that the development of content is driven by these teams, but we don't want HR to be solely responsible for disseminating that information. I think there were many examples of HR leaning across and outside of compensation and benefits, like I said, with these employee resource groups, with learning and development, also with talent management and acquisition teams, as well as leaders and employees in these non-HR spaces. The second challenge here is around measurement and reporting. So how are companies determining which benefits are actually the most helpful? And I think an underlying and unintentional question here is what will be the future of rewards now that this pandemic has happened? This includes questions around how ROI is calculated, questions around how you're measuring the transfer of knowledge. There are a lot of new resources and trainings being offered, but how to know if those are actually working and happening in the workplace. And then also thinking about ways that you can hold people accountable for this work. So if you're defining these as new competencies or skills that you want employees to have, are you integrating them into your performance conversations? And I think for the manager population and specifically, are you elevating those as call outs in order to be defined as a good leader? The third problem here is around communication. And I think this is probably what came up most frequently, of just it being really difficult to find ways to hit all of those populations, in particular the frontline employees or those in service roles. I think benefits can be a double-edged sword, where if you offer too little, you're missing an opportunity to meet the needs of your employees. But on the other end of the spectrum, if you offer so much, it can be difficult for employees to actually navigate that process and to know where they should click into or how to find the resources that they need. So we've seen a couple interesting ways that companies have done that. A lot of this surrounds the kind of internal websites that exist. But I think to make these portals as direct and customizable as possible is one of the best ways to do this, and not solely relying on this kind of trickle down theory of just talking to top level leaders and hoping that those messages hit the employees, especially on the front line. I think there are also opportunities here that we've seen highlighted with some companies doing more of those novel practices of leaning onto their communications and their IT teams to really think creatively around how to best communicate some of these shifts and benefits. The fourth pillar here is around leadership, and I think this most directly ties to our initial research question around the management population, and just really thinking about how you're defining people leadership. Like I mentioned earlier, are you integrating this into your performance conversations? Will it be used for end-of-year reward systems that you have in place? And I think it can also be an opportunity to think of new ways to highlight and pick out how you're defining a high potential employee that you do want to go into leadership as well. I think a big question here, though, does still persist of how are you supporting your managers with their own mental health and well-being concerns. We've often heard the idea of you have to put on your own oxygen mask right before you put it on another. And I think there's a lot being asked of the manager population. This was a question we asked. I think it's still a question that persists of how to really help and cater to that manager population as they juggle these responsibilities. And the last question here is really around disparate impact in diverse populations. So we've already talked about caregivers, we've talked about people of color. I think it's important to also highlight those who are early in their career, since they are dealing with the most increased levels of isolation according to our research, and especially those who also have pre-existing conditions around substance abuse or mental illness. I think this gives us an opportunity to think long-term and kind of downstream effects. If you're seeing a lot of women in your workplace having to off-ramp or having to decrease their work hours, are you thinking long-term around what that may impact or how it may impact your pay and promotion equity, how it may impact retention rates across some of these specialized populations as well? And when you think about your international population, since there are differences in culture, policy, government, also thinking about ways that you can still tailor and meet the needs of your international populations, even despite some of those cultural differences, since mental health is a universal truth. So I think in many ways, these challenges aren't new, as many of you have highlighted throughout our conversations and even in our peers' presentation. They're meaty and they're critical for a successful strategy. So this isn't meant to be, again, any kind of judgment call, but I think another helpful framework as you start thinking about how you want your programs to be effective in the long term. So in conclusion, we can kind of wrap up with these two main takeaways. The first being that as you start to think about your strategy, I think our 4x4 or 2x2 4-quadrant framework is a great way for you to start thinking about the effectiveness of your strategy by thinking in these two dimensions, where you currently are, where you want to be, and using some of those guiding questions to help you get there. I think this challenges slide helps you push beyond effectiveness and start to think a bit more about the sustainability of your programs. And these are 5 different areas that you can kind of poke into to think about how you might extend these practices beyond, hopefully, the soon end of this pandemic. But before wrapping up officially, we did want to thank all of our participating companies. These were truly fruitful conversations. It's very helpful to kind of get this firsthand knowledge. And so we want to thank you and take the time to thank you for letting us know about the amazing work that's happening in all of your spaces. So from there, I think we can kind of wrap things up and open it up to any questions that may have come in.
Great, thanks Tiffany and Nate, great presentation. Lots of great insights for our companies around really managing this important topic. So we do have a couple questions which we'll tackle quickly here before we wrap up. One question, I think this refers to you, Nate, and your last slide on kind of some of these innovative practices. Somebody kind of asked, you had a bullet there, performance reviews driven by employee well-being. Could you just say a little bit more about that specific practice?
Yeah, no problem. So we heard this from 1 or 2 partners where, so I'm trying to remember exactly how it worked, but basically you could think of the employee experience that they measured with regular pulse surveys, for example, had a dimension around well-being, like how are you doing at work today, what have you. And then this was often included in their manager's review, right? So they just factor this in. I don't know what the actual outcome would have been in terms of, kind of maybe like the differences in the rewards for that manager, but it was certainly part of their, maybe an area for them to work on if it was showing up that their employees were often reporting, some mental health challenges, either an area for them to kind of directly work on or just an area to flag. So we saw this as one of those kind of ways to be more integrative, right? Where, you're not just telling everybody to take care of their mental health, but actually your mental health is going to be accounted for in the way that we review your manager and the way that we might develop the manager as well. So hope that helps.
Yeah, great, thanks, Nate. Maybe Tiffany, this one's for you. You kind of highlight early and as well at the end this idea of there's specific employee populations that have their own kind of specific needs. And the question is, certainly it makes a lot of sense, this more personalized approach. Did companies talk about like some of the challenges or maybe trade-offs in that approach as well? You can imagine if a company is really focusing on caregivers, for example, do employees that are maybe early career and single, do they feel maybe like they're marginalized or not getting the same attention? So how do companies kind of manage some of those trade-offs in this more personalized approach?
Yeah, and I think that's a great question too, because it seems like that's where some of the hesitancy lies of kind of making these more tailored programs. It's like a question of equity and feeling if we kind of lean too heavily in one group, are we then kind of ignoring the other? I think we've seen a couple companies who had very tailored kind of internal websites where you almost took a quiz kind of outlining some of the different dimensions of your personality, and that brought you to a final landing page that showed you some of the resources that were directly tied to those identities. And I think that's an interesting way to kind of approach it from a kind of consumer perspective. I think tactically, though, it's really important to utilize these pulse surveys. I think to also just ask managers and ask employees directly where the pressure points are, because there are likely populations we don't even have included on that slide who are also having unique pressures where there is a very easy benefit offering that might be able to, be incorporated in order to address it. So I think keeping the communication channels opening and then creating those customized options are the best way to kind of mitigate any of the differences between those different population groups.
Great, thanks.